Alright, in this lecture we're going to talk about the forearm muscles. There's a lot of muscles in the forearm, so we got a lot of work ahead of us here. So let's start with an overview. So in general, the forearm muscles are responsible for a number of movements. Movement of the hand at the wrist joint, so flexion, extension of the wrist, abduction, adduction of the wrist. Movement of all 5 digits, so flexion, extension of the fingers and the thumb, and then pronation, supination of the forearm. Now, they're just like the other area, just like the arm, and then it's going to be true in the legs as well, that they consist of compartments. And so here we have 2 compartments in the forearm, the anterior and the posterior. So this is your anterior compartment here, okay? That's your anterior. And then you have your posterior compartment back here, okay? And the anterior compartment is thought of as containing as the flexor compartment, because many of these muscles do the flexion at the wrist, flexion of the fingers, flexion of the thumb. Posterior compartment's thought of as the extensor compartment, because again it extends the wrist, the fingers, the thumb. Then each compartment, both the anterior and posterior compartment, they can contain superficial and deep layers of muscles. Okay, so as you can see that here, there's a nice layer of superficial and deep. And this is important, both just understanding the anatomy, understanding a cross-section anatomy like this, and then when you're dissecting is, you've got to go through more superficial muscles, then you're going to make it into the deeper muscles, which are, closer or even on top of the bone. And these 2 compartments are separated by the interosseous membrane, which, as we talked about, goes between the radius and the ulna, and so that's what separates these 2 here, these 2 compartments. So we'll start with the anterior compartment, the flexor compartment. All of the muscles, so this is how you can help keep your innervation straight. So you're in the flexor compartment. It's all of these muscles are innervated by the median nerve, with the exception of 1.5 muscles, which are innervated by the ulnar nerve. One of those even has ulnar in its name, Flexor Carpi Ulnaris. So right there you can remember that's just the ulnar nerve, okay? And then the other is a half of a muscle, Flexor Digitorum Profundus, which is the medial, also known as the ulnar half, in the forearm. In the forearm, the medial half of the forearm can also be thought of as the ulnar region, or the ulnar surface, or the ulnar side. So that's another way you can help remember that. And we'll go through each muscle individually in a minute here, okay? So the main actions of the compartment are, again, they flex, abduct, and adduct the wrist. So you have both these motions in the flexor compartment. They flex the thumb and the other 4 digits, and then pronation of the forearm. It's broken down into 3 layers, okay? So you have a superficial layer, which has 4 muscles. You have a middle layer, which really has 1 muscle, that's it. And then you have a deep layer with 3 muscles, okay? And so the way you can remember this is 4, 1, 3. So you remember these 4 superficial ones. You remember the one that's in the center, which is it's just 1. All you got to remember, and then there's 3 below that. So that's a kind of a way you can keep this straight in your head. All right, so now we're starting with the superficial layer here, okay? Which has 4 muscles in it, okay? And we'll show that right here. So this is your 4 muscles right here, okay? Pronator Teres, Flexor Carpi Radialis, Palmaris Longus, and then Flexor Radialis Ulnaris. Some people will kind of remember it as PF. That's the one way you can remember it. So we'll start with Pronator Teres. The attachment of the origin is the medial epicondyle of the humerus, which is this right here. And you can see there's like this, almost this flexor wad here is what it's referred to as, which it's because it's the origin of a number of muscles in the flexor compartment. Where does it insert into? It inserts into the lateral radius. So you can't see the insertion too well, but it's tucked here behind this brachioradialis muscle, and it attaches on the lateral end of the radius here, okay? Which would be coming down this part here. The radius would be on this side, the ulna is on that side, okay? And this is an anterior view. Movement, so it pronates the forearm. Now remember, for one thing, it's in the name, Pronator Teres, pronates. And so if you remember, muscles contract, they shorten, and they're going to pull. So it's going to pull, if it's pulling from this lateral edge of the radius, it's going to pull it this way, okay? Which is going to help pronate the forearm, okay? And which essentially means turning the palm downwards, okay? Or to the dorsal surface. Also, it's not a major flexor of the elbow, but it does cross the joint here, as you can see. So it does do some flexion of the forearm, or flexion at the elbow joint. And innervation is median nerve. All right, so same diagram here, superficial layer. This is your Pronator Teres here. So this is the muscle here we're talking about, Flexor Carpi Radialis. Again, simple to remember the origin. It's the medial epicondyle of the humerus, this flexor wad. Where does it insert into? Onto the base of the second metacarpal, which are these long bones in the hand here. And what it does is the second would be, it comes down and it inserts onto the index finger. So you see the muscle here has a nice long tendon. Here's the tendon going into the hand here, and then it inserts onto the second metacarpal. Now, if notice it crosses the wrist joint, because if it's going into the hand, it's gonna cross the joint. So what does it do if it contracts? It contracts, it shortens. It's gonna pull the wrist this way, flex it. Okay. Another thing it does is abducts the wrist, which is also called radial deviation. Okay. Because in the forearm, another way to keep your anatomy straight is there's the ulnar side and the radial side. That's another way to describe it. And so if you notice, it's pulling kind of this way, pulling this way, so it's going to pull it out that way, which would be radial deviation, which is where you essentially bring your thumb closer to the lateral surface of the distal forearm or the distal wrist. And this innervation is median nerve. Next, we have the Palmaris Longus, which is this muscle right here. So Pronator Teres, Flexor Carpi Radialis, Pronator, and then Palmaris Longus. This is a muscle not everyone has. You can kind of see on yourself if you extend your wrist out in front of you, and then you curl your fingers in and make a fist real tight. You'll see this tendon kind of pop up down here on the anterior surface of your forearm here, or your wrist. And where it inserts onto is the flexor retinaculum, which is a band structure like this that extends here at the wrist and helps form the carpal tunnel, which we'll talk about in the hand region, in the hand lectures. And then it also inserts onto the palmar aponeurosis, which is this kind of thick connective layer sheath just deep to the skin on your palmar surface of your hand. So it extends down onto that region as well. Now what does it do is it flexes the wrists, because it does cross the wrist joint here. So this is your wrist joint. And it's not a major flexor of the wrist, but it does cross the joint and helps with some flexion. It also tightens the palmar aponeurosis because it inserts directly onto it, because it's going to contract, it's going to pull on this palmar aponeurosis. Innervation here, median nerve. Flexor carpi ulnaris. So this is the last of the four superficial layers, or superficial muscles. Okay. And so that's this muscle right here, okay? So it has a humeral head, which attaches here onto the medial epicondyle. So it has two heads, a humeral head and an ulnar head. So then you have the humeral head, and then the ulnar head attaches to the olecranon and the posterior border of the ulna. So you can't see that here. It's almost, if you were to go deep to this, you could see the ulnar head traveling in here, okay? And this structure actually helps form the cubital tunnel, which we discussed in the elbow lecture, and when we talked about cubital tunnel syndrome as well, where you can get compression of the ulnar nerve. Insertion is on the pisiform bone, the hook of the hamate bone, and the fifth metacarpal. So it comes down here, crosses the wrist joint like this, and then inserts onto these bones in the hand. So since it crosses the wrist joint, and if it contracts, it's going to shorten like this. It's going to pull the wrist up, flex it. Now, since this is the ulnar side, this is the radial side, it's going to adduct. So since it pulls this way, it's going to also pull the wrist this way, or pull kind of the side where your pinky finger is on, pull that side of your hand closer to the distal edge of your forearm. And then this is innervative, this is the exception, ulnar nerve. So you look at the name, it's in the name, ulnar nerve, not that hard to remember. So this is Flexor Digitorum Superficialis, which is now we're in the middle layer, okay? And it's the one and only muscle of the middle layer, okay? So it has also two heads. It has a humeral ulnar head, which attaches here on this medial epicondyle. And so we'll show it down here. Here's where it's located. So here's our superficial muscles here, these four right here. So if you were to peel those away, then you're on top of the Flexor Digitorum Superficialis. And it's not named, so this may be confusing. Even though it's Superficialis, you may think, oh, it's superficial layer. Not true. It's named so because it's superficial to the Flexor Digitorum Profundus muscle, which is just deep to it. And in fact, there's a distal portion of the median nerve that runs in between the two muscles, and we'll talk about that more in the nerve section of this chapter, okay? And what we have here also is the radial head, which attaches onto the radius, so it kind of it extends down and attaches onto the radius, because the radius is on this side, ulna on this side, and it comes down like this. Okay, so it's got two attachments. It's attaching to both bones, is what's in, or both the radius and the humerus. Okay, so two different bones, and then we show the distal portion of it here, where it kind of spreads out into these tendons like this that form these hoods, and they form these distal attachments onto the middle phalanx. So, or the middle phalanges of the fingers, and you have phalanges in your toes. So that's why people make the distinction phalanges of the fingers. Now, there's the middle phalange, which are middle phalanx, which is here, proximal phalanx here, and then the distal phalanx here. So 3 bones in your fingers. There's only 2 phalanges in your thumb. Okay, but we won't talk about that. We'll talk much more about this osteology in the hand lecture. So just to give you, so you know what we're talking about here. And then there's interphalangeal joints, or the IP joints, okay? So that would be here between the proximal and middle phalange would be your proximal interphalange joint, so your PIP joint. Then you have between your middle and distal phalange your DIP joint. So there's only two interphalangeal joints. So there's your interphalangeal joints, and then there's 1 and 2. So your proximal and your distal. Okay, there's no middle interphalangeal joint. So there's PIP and DIP. That's usually how they're abbreviated. Then there's your metacarpals, which are the bones in here just proximal to your phalanges, and those make a joint. So if this is a metacarpal, and then it forms a joint with the proximal phalanx here, so proximal phalanx PP, this is your MCP joint, okay? Now, the reason we're going through all this is because it has to do with the action of this muscle. So the MCP joint is the metacarpophalangeal joint. Metacarpal phalangeal joint, okay? All right, so let's clean this up and we'll show you the movement. So this is your PIP joint here. It's your DIP joint. And then your MCP joint, okay? So, as you can see here, it's going to contract, okay? So it's going to contract, and it's going to pull, and so as you can see, it's going to pull the finger up on this PIP joint. So flexes the PIP joint, as you can see here, flexes, and so on. And it crosses the MCP joint, so it also helps with flexion. Now, what's an important thing to know, this is not the main flexor. There's actually intrinsic hand muscles here that are actually the major flexors of the fingers, and we'll talk about that in the hand lecture. But so be aware of that. This is much more involved in flexion of the PIP joints, okay? And then this innervation is median nerve. Now, Flexor Digitorum Profundus. Now we've cut away the superficial layer and the middle layer, so now we're in the deep layer, okay? Which is our 3 muscles. So remember, the superficial has 4, then the middle has 1, and then you have the 3 in the deep, okay? So this is your Flexor Digitorum Profundus, which is just deep to Flexor Digitorum Superficialis, and in fact, the median nerve travels just between these 2 muscles to give yourself some kind of spatial anatomy that's important to know. Proximal ulna is where it attaches, so it has a nice broad attachment on the ulna. So this is the ulna side, this is the radial side. It has a nice broad proximal attachment to the ulna. Then the insertion is the base of the distal phalanx of digits 2 through 5. So again, you have your proximal phalanx, so your PP, your middle phalanx, MP, and then your distal phalanx, DP. Then you also have your DIP joint, and then you have your PIP joint, okay? And then you have your MCP joint, because your metacarpals are in here, okay? So it inserts onto this distal portion here, which is your distal phalanx. So on the tips of your fingers, your fingertips is where I would think of. So if you remember from that the diagram with Flexor Digitorum Superficialis, so they make these hood-like structures with the tendons. So this is FDS, which is abbreviation for Flexor Digitorum Superficialis, and they're inserting, if you look at here, if we're kind of looking at it from an anterior view or a top view, it's inserting onto the middle phalanx here, okay? And then you have the distal phalanx, or your fingertip, out here like this, okay? And then this would be your DIP joint, okay? The tendon comes out underneath that hood and then attaches onto here, okay? So this is your FDP tendon, okay? So you have, just to review here, you have your middle phalange or middle phalanx here like this, okay? Flexor Digitorum Superficialis comes down and inserts onto the middle phalanx of the fingers, and it makes this kind of hood-like structure, like this arch-like structure. And the Flexor Digitorum Profundus tendons, they come underneath those tendons through that tunnel action here, like this, and then they insert onto the distal phalanx, okay? So I want to make this very clear because this is something that people confuse very often. So if we go through this one more time here. So this is your distal phalanx, your middle phalanx, and then your proximal phalanx. Okay, so PAP. Then you've got your PIP joints and your DIP joints. Okay, so just another view of it if you don't like that view. So Flexor Digitorum Superficialis comes in, attaches here, here, and then you have Flexor Digitorum Profundus, which is already deep to this. It comes in and it just kind of comes just deep to that, and then all the way out here to the distal phalanx, to the tip. So when you flex, if you just flex your tips, your fingertips, which would be your DIP joints, that's profundus. That's how you can isolate profundus. You ask someone to flex just the tips of their finger, okay? And it does cross the wrist joint, as you can see here, so it does do some minor wrist flexion. Now, the innervation, this is important to know, okay? So you have a medial part, so which would be your ulnar side, so this is medial, okay? And then you have your lateral or radial part, okay? So if we split this muscle right down the middle here like this part is ulnar nerve, which makes sense because you're on the ulnar side. This side is AIN, which is anterior interosseous nerve, which is a extension of, so the median nerve splits into the AIN, okay? And so the AIN is a terminal branch of the median nerve, and so it's essentially median nerve, but it's the official name is the AIN, which is a branch of the median nerve here in the forearm, okay? Flexor Pollicis Longus. So this muscle here, if we get into it here, this is your Flexor Pollicis Longus here. The origin is the radius shaft. It inserts on here, has a nice broad proximal attachment, and it goes onto that distal phalanx of the thumb. So if we go through the thumb here, your thumb only has two phalanges. So you have proximal phalanx, and then you have your distal phalanx, okay? Then you have your interphalangeal joint of the thumb, okay? So just two bones, because if you think, you have one less joint in your thumb than you do your fingers. And then it flexes the phalanges of the first digit, okay? So that tendon is going to come through this Flexor Pollicis Longus. As you can see that tendon coming in right through here. It's traveling deep to these muscles in the hand, and then it comes out here and attaches down to the distal phalanx, okay? So then what does that tendon do? It comes in here. You pull on the tendon, so again, pull this way, you're going to flex it, okay? So this is AIN, which is a branch of the median nerve, okay? I mean, long and short, you want to just know it's median nerve. There's it depends on what your professor expects. It's a good question to ask them for the test is, are they going to want you to distinguish innervation median versus AIN? Because there's certain muscles that it's AIN is the most specific answer if they want the most specific answer. And then there's other muscles that are innervated by the median nerve, but they're not innervated by the AIN. And we'll go through the distinction in more detail when we talk about the nerves. Now, Pronator Quadratus, so we're still in the deep layer. This is the third muscle of the deep layer, the third and last. So that's this muscle right here, okay? And this is directly on top of the bone, and it has these horizontal fibers, okay? If you notice, it's perpendicular to the muscles that, the rest of the muscles in the forearm, which have these longitudinal fibers like this. You can see that here, like this, okay? So it goes across, and that has to do with its function, because it has a different function. And again, it's in the name, Pronator Quadratus pronates, and so it needs to have these horizontal fibers to carry out its function. So its origin is the distal anterior ulna. So again, this is your ulna, this is your radial side. So this is where its proximal attachment, it attaches over here onto the distal anterior radius. So this muscle, just like any other, it's going to contract, and it's going to pull it's going to pull this radius over the ulna, okay, to help pronate it. So Pronator Quadratus works with Pronator Teres they both, neither one acts in isolation. They both act together to pronate the forearm. Okay, and then the innervation would be AIN or median nerve. Okay, and one thing to note is the pronator muscles, the muscles that pronate, are in the flexor compartment of the of the forearm, and then the muscles that supinate, they are in the extensor compartment. Okay. So the posterior compartment of the forearm contains the extensor muscles, and for all intents and purposes, they are all innervated by the radial nerve. Okay, and so the actions. So in general, just to review that, flexor compartment, you want to think mostly median nerve. Couple muscles are ulnar nerve. Extensor compartment here is going to be radial nerve. So what are the main actions of the posterior compartment? They're to extend abduct and adduct the wrist. So both muscles muscles in both compartments help with abduction and adduction of the wrist, but it's the posterior compartment that extends, anterior compartment flexes, extends and abducts the thumb, and then extends digits 2 through 5. So extends all 4 fingers, and then they also help with supination of the forearm. So the muscles in the anterior compartment help with pronation, muscles in the posterior compartment help with supination. So it's broken down into 2 layers. Remember the anterior compartment had 3. Posterior only has 2. There's a superficial layer, which is 6. Deep layer has 6. So a good way to remember it is 6 and 6, 12 muscles altogether. And again, this is the divider. The interosseous membrane is the main divider between these 2 compartments, and this is where they're contained. So first, brachioradialis. Some people confuse this muscle. They think it's a flexor because it ends up wrapping around and traveling kind of on the lateral aspect or even near the anterior. So some people think maybe it travels in the anterior compartment, but it technically is a posterior compartment muscle. It originates on the lateral supracondylar ridge of the humerus. So you can see here, this is our posterior view of the forearm. This is our anterior view of the forearm. So here's brachioradialis right here, and here it is originating onto the lateral supracondylar ridge of the humerus. It wraps around the posterior surface, and then it travels kind of on the lateral or radial side, because on this side it would be radial and ulna. On this, however, anteriorly, this is going to be the radial ulna because we've flipped. This is posterior view, anterior view. Here's your brachioradialis here after it's wrapped around of the elbow joint there, and then it goes down and attaches distally onto the lateral surface of the distal radius. So down here. Now its movement, it doesn't cross the wrist joint. So the brachioradialis, that's another thing when people are first learning anatomy they can confuse, is that maybe it acts at the wrist joint. It actually attaches just proximal to the wrist joint. So it doesn't do anything at the wrist joint. The only joint it crosses, as you can see here and here, is it crosses the elbow joint. So it flexes, it actually helps flex the forearm, which is again makes this muscle confusing because it's technically a posterior compartment, but it flexes the forearm, and it's innervated by the radial nerve. And a good spatial relationship to be aware of, that, and we'll talk about this when we talk about the nerves and vessels, but just deep to brachioradialis is the superficial radial nerve, which is a sensory nerve in the forearm, and then the radial artery. Okay, so those 2 structures, and we'll go over that again when we talk about the vessels and the nerves. So extensor carpi radialis longus. Now, just like in the flexor compartment where a lot of muscles shared a common origin in the medial epicondyle, you have this common origin on the lateral supracondylar ridge of the humerus and the lateral epicondyle. So again, right here, same origin as brachioradialis. And this muscle, as you can see here, this is the muscle right here, extensor carpi radialis longus. It comes down here, travels on the radial or lateral side, comes down, travels down, and then it inserts on the base of the second metacarpal. Second metacarpal would be the metacarpal of your index finger. So you can see it coming down here, and then it attaches in this region right here. Now, it crosses the wrist joint, so a major action is to extend the wrist. It also, it crosses the wrist joint on kind of the radial aspect or the lateral aspect of the wrist joint, so it also helps with abduction, which is helping move the wrist this way, kind of pulling the thumb closer to here. Because remember, again, muscles, the old muscles contract, they extend, and then they can pull this way as well. And innervation's radial nerve. Extensor carpi radialis brevis. Again, lateral epicondyle of the humerus. So we go down a little more distal here. This is the muscle right here. It travels, just deep and a little more proximal distal attachment to to the longus, and then it travels down here as well, and it actually inserts onto the base of the third metacarpal, which would be the middle finger. Okay, so base of the third metacarpal. Its movement, again, as you can see, it crosses the wrist joint here, so it extends the wrist, and it also helps with abduction of the wrist. So very similar. The only main difference is it's one finger over on the distal attachment, a little bit more distal, lateral epicondyle instead of supracondylar ridge. Same motions as the longus. And then the deep branch of the radial nerve. So when the radial nerve comes down into the forearm region, and we'll go through this in more detail when we talk about the nerves, but just so you can understand the differences in the innervation of the forearm muscles, is it comes down, so here's the radial nerve, and it splits into the superficial radial nerve, which is a only sensory nerve that travels down the forearm, down into the wrist region. Then you have the deep radial nerve. So the deep radial nerve travels, and that goes through the supinator muscle, and then when it comes out on the other side, it becomes the posterior interosseous nerve. And again, we'll go over this in much more detail when we talk about the nerves just after we talk about the muscles here. But this is just to give you an idea. So this is PIN, or you may hear people refer to it as PIN, and it can be important on anatomy exams where you want to be. Sometimes people can get picky on which is the exact innervation. So you want to be careful. Radial nerve isn't always the right answer. There's some muscles where if the innervation is proximal enough, it's always radial nerve. Doesn't matter how specific you're going to get. But if you get more distal here, it could be PIN, it could be deep radial nerve if it's up in this region. Muscle innervation will never be superficial radial nerve. That's a completely sensory nerve. So the big distinction you want to make is between radial nerve, deep radial nerve, and then PIN. So extensor digitorum, lateral epicondyle of the humerus, so that's in here. Here's the muscle right here, and as you can see, it shares that common origin at the lateral epicondyle. It's also called the extensor wad, just like the flexor wad in the anterior compartment. And as you can see here, it comes down, and it's similar to the flexor digitorum muscles in the anterior compartment. It fans out like this into the multiple attachments, and it attaches onto these. You can see they're kind of like hood-like structures. They're called the extensor wad or the extensor hood. And so that's where they make their attachment. You can see them coming in here onto these extensor structures here of the medial 4 digits, which is also known as just your 4 fingers. Now, if you remember our joints here, we have the MCP joints here, the metacarpophalangeal joint, and then you have your PIP joint, and then your DIP joints. So they cross the MCP joints, so they extend at those joints only. Okay, they do not extend at PIP and DIP. Those are different muscles in the hand that we'll go over later. It also crosses the wrist joint, so it extends the wrist as well. Okay, you can see it crossing right here. Innervation is PIN, posterior interosseous nerve. Extensor digiti minimi. So that's this kind of little muscle right here, tucked more deep to these muscles here. And you can see it coming out here, and you can see this nice attachment onto the 5th finger here, the extensor expansion of the 5th digit. And this is a muscle. It originates on the lateral epicondyle of the humerus, on the lateral extensor wad. And if you can see here, it crosses the MCP, the PIP, and DIP joints. So it extends all those joints of the 5th digit, just the 5th digit. And then that innervation is PIN as well. Extensor carpi ulnaris. So here's the muscle right here. And it's coming out more medial than these other muscles here, coming from the lateral epicondyle of the humerus. It also originates from the posterior border of the ulna, because the ulna is going to be here if you were to dissect down, and the radius is going to be here. So it comes out this way, and then it attaches to the base of the 5th metacarpal. So you can see that right here, and then it attaches right here at the base of the 5th metacarpal. It's involved, it crosses the wrist joint, so it is involved with wrist extension. And then since it crosses on the medial or ulnar side, this would be the radial side, it helps with wrist adduction, so pulling the pinky finger or small finger towards this aspect of the forearm, so wrist adduction. And in its innervation is PIN, which is a thing to pay attention to, because even though it has ulnaris in the name, it is not innervated by the ulnar nerve, it's PIN. The Anconeus muscle, this is a muscle right here. It's a kind of a unique shape to it. It originates from the lateral epicondyle of the humerus, so it originates from over here, and then it wraps around kind of the elbow joint and attaches onto the lateral surface of the ulna. So again, this would be the ulna here, deep, and the radius deep here. It wraps around, and it has some, because of its unique shape and location, it assists in the triceps and extending the forearm, so extending the elbow joint, because it crosses over the elbow joint. It helps stabilize the elbow joint, and then it helps abduct the ulna. So here's the ulna here. It contracts, pulls this way during pronation. So when you're doing the pronation movement, it helps with that as well. So these are kind of unique movements. This isn't a terribly high yield muscle, but it's just important to be aware of. And then it's innervated by radial nerve because it has a more proximal origin up here. So the radial nerve hasn't split yet. Now we have the supinator muscle. So that's this guy right here, this nice broad sheet-like muscle. And it originates, as you can see here, from the lateral epicondyle of the humerus, and then the proximal ulna as well. This is the ulna. Here's the olecranon. So it has this nice broad origin. And then it inserts onto the proximal radius. So you can't see that too well here in this diagram, but it wraps around from this origin and then down onto the proximal radius in this region. And what it does is, it's in the name. It helps supinate the forearm, which helps, I like to think of it, cup of soup. So you turn the forearm where the palm of your hand is facing upward or facing anterior. And the innervation here is the deep branch of the radial nerve. And that's a good thing to remember, because if you remember, the radial nerve comes in here and it splits into that superficial radial nerve, which travels out this way, which is the sensory nerve, and then it goes into that deep radial nerve, which actually pierces the supinator muscle. And in fact, it can even get entrapped in the supinator muscle. And then when it exits out the other side of the supinator muscle, that's when it becomes PIN. So the supinator muscle, it can help you remember that anatomical relationship, can help you remember its innervation. So Abductor Palmaris Longus muscle, this is shown here. And this is a muscle that has several points of origin, the ulna, the radius, and the interosseous membrane between them. So in this diagram, you have the ulna here, the radius here, so it has a very broad origin. And then it comes down and inserts at the base of the first metacarpal. So you can follow the muscle down, and it's going to insert right about in there. And the only joint it really crosses is the carpo-metacarpal joint, which would be in this region here. And the carpo-metacarpal joint is a joint between the carpal bones, which are these bones that are at the wrist here and articulate with the radius and ulna to form and then the metacarpals, okay? And so it's a joint between those two bones. And so since it crosses only that joint, it's going to extend the thumb there. It also helps abduct the thumb. So, and that's in the name, Abductor Palmaris Longus. So it comes down here, muscles contract, it helps pull the thumb out this way. Innervation is PIN. So the extensor Palmaris Longus is shown here. And then the extensor Palmaris Brevis is here. And this is one of two muscles that extend the thumb. And as you can see here, here's the ulna here, the radius here. This muscle is coming out from the ulna and then the interosseous membrane, and then it inserts onto the base of the distal phalanx. So you can follow the tendon right here in the diagram. Here's the distal phalanx here. Here would be the proximal phalanx here. So as you can see, it's crossing the interphalangeal joint. It's also crossing the MCP joint of the thumb and the carpo-metacarpal joint. So it crosses all the joints of the thumb. And as you can see here, and because it crosses all these joints, it extends the distal phalanx of the thumb, but it also extends at this joint, and then it extends at the IP joint as well of the thumb. And then the innervation would be PIN. Extensor Palmaris Brevis is this much smaller muscle, as you can see here, which again, this would be the radius deep here. Here's the ulna actually shown here. And this muscle, unlike the longus, actually comes off the radius. And you can see that here as a more radial origin and course, and then it comes off the interosseous membrane, goes down to the base of the proximal phalanx. So this one attaches more proximal on the thumb, more like here. And then since it only reaches out to there, it extends as the proximal phalanx of the thumb at the MCP joint, okay, which would be in this region here, okay, the MCP joint. So this, even it's a smaller muscle, shorter course, and it's more responsible for extending the MCP joint of the thumb, and then it's innervated by PIN. Extensor Indicis, so that's a muscle that can be shown right here. So here's your Extensor Indicis. It's very deep in there, and it emerges out here after originating from the ulna and the interosseous membrane. And you can see here's the ulna here, and it comes off kind of more the mid portion of the ulna, not so much the proximal. And then it comes out here and it inserts onto the extensor expansion of the second digit, or this extensor hood. You can see that very nicely here. All right, so we did it. We covered all the muscles of the forearm. Now we're on to the blood vessels and the nerves in the forearm.